Hey, this is John Hansbrough. Thanks for joining me today. Today, we're going to talk about price transparency, and it's kind of counterintuitive, but I'm going to leave you with 3 reasons why price transparency isn't the solution to healthcare costs that we sometimes think it might be. So if you're interested in learning more, stick with me. I'm going to give you a little background on a recently published research paper, and then we're going to dive into those 3 reasons. Thanks. Let's go. So for some background on that research, some researchers out of NYU and Harvard, they looked at basically price transparency tools that were available from the state of New Hampshire. New Hampshire has one of the most widely available and well-populated price transparency tools on what providers are charging for different services throughout the state. So is what these researchers did is that they boosted traffic to that website, and then they tracked spending afterwards based on some commercial insurance populations. Interestingly, is what they found is that by just paying for some Google ads, they got a lot of people to go to that website. They hit a huge uptick in visits to the website. And interestingly, it wasn't just direct visitors, but even non-paid traffic, so organic traffic, increased to the website. Is what that seems to tell us is that once some people were getting onto the website, they were telling other people about it who were then going to the website themselves. So this is pretty cool. It's people going onto this website, looking up the cost of providers, looking up the cost of services, trying to get an idea of how much services are going to charge. And the idea here, the underlying assumption that we have within healthcare is that if people know how much healthcare is going to cost, they're going to make different buying decisions, and those buying decisions can lead to lower overall healthcare spending. That's the idea. It's why it's been so popular and talked about in a lot of healthcare circles as price transparency being this panacea, this solution to healthcare spending. We saw this in the last administration where the Secretary of Health and Human Services, Alex Azar, he talked about how putting patients in the middle of that system gives them options. It gives them the ability to know the prices of things. It's going to make them smarter consumers. It fits into this narrative of the consumerification of healthcare. So obviously the question is, how did that play out? What happened? Kind of surprisingly, the researchers found that while the traffic went up to the website, it didn't actually change spending. That's kind of a surprising finding because it definitely flies into the face of this idea where increased price transparency and consumers' knowledge of prices is going to lead to lower spending. So what was going on there, and what are those 3 things about it that employers need to know if they want to effectively reduce their healthcare spending, and how price transparency plays a role? So the first underlying assumption is that if employees know how much things are going to cost, their procedures, their services, their labs, and whatnot, that they actually have a way to implement that in the healthcare decisions that they make. That's a big assumption that we don't find actually bearing out for a lot of organizations. So just because people know how much things are going to cost, they need to actually be equipped to put that into practice. So employers need to make price transparency tools available to employees, as well as tools to actually use them and go to lower price services, higher quality providers, and whatnot. Second, and this is a really big one within our organization, the consulting we do with groups, is that employees need to have an incentive to consume lower cost healthcare. It doesn't really matter for them if they know that the cost of an MRI is going to be $500 at the lab down the street versus $2,000 at their local facility, if they're just paying their copay each time. If their copay is just $150, it doesn't really matter to them how much the insurance plan spends on that test. So it's really important that networks are designed within plans to steer employees towards those lower cost providers who are still delivering care at a high quality. So what we're seeing in this space is that employers not only provide price transparency tools, but they also introduce multiple tier networks with preferred pricing, so employees are steered towards high quality, low cost providers who are doing great work, but employees are incentivized and rewarded for going to those providers, sometimes with as little as no or very small copays. The final thing for employers to know about price transparency tools is that healthcare spending is just kind of weird. It's kind of this thing that doesn't really sometimes conform to standard economic principles. Talk to any health economists out there, they would agree with the same thing. Healthcare is just weird. Consumers make illogical decisions in some ways. I guess you could argue it. But really the idea here is that maybe a good comparison is wine. People seem to like buying wine that's not necessarily dirt cheap. There's been studies before on wine that if you increase the price of wine, the consumption actually goes up. And so it's possible that some consumers see low healthcare prices as actually being low quality. They might ascribe low cost to low quality. Whereas in healthcare, and we've talked about this before, high quality providers can actually perform services typically at lower costs than other providers who are not necessarily as specialized or as good at that same procedure or service. Another way to think about that is the proverbial character on TV who says, I want the best doctor, I want the best hospital, blah, blah, blah. When they say that, they're typically just going to go as a rule of thumb with whoever's most expensive. That's not a really good use case for how price transparency tools can help employers spend less money on their healthcare. There are a few indirect benefits of price transparency tools that won't necessarily directly impact employers' bottom line spending on healthcare in a given year. The first one is that price transparency tools can allow providers and payers, so health insurance carriers, ACOs, TPAs, to have better negotiations because they're aware of prices in the market. And so that's typically known as a supply side effect. So it's not really consumers making different decisions. It's the marketplace that is setting prices is being a little bit more responsive and reactive to what's going on in that marketplace. So that doesn't happen overnight. That does take some time. And so as we see these price transparency tools stay around for a few years into the future, I think we'll start to see some reduction in variance of prices as providers start to see that, hey, you know what, health system A, you can't be charging $30,000 or $40,000 for that knee replacement when this other health system in town is doing it for 10 or 15. That kind of thing is going to have a deflationary effect on healthcare prices that we should see in the next couple years. The other benefit has to do with employees. So while employees may not necessarily choose lower priced care all on their own, the thing that it will do is it'll help them budget for the care that they do consume. And so that's an issue that we do see with employees. They sometimes don't know how much services are going to cost, but when they do, they can budget around them, they can allocate money and save towards certain expenditures, and they have better knowledge of how much services are going to cost before they go and consume them. That's a big issue in healthcare, and it's a very helpful thing for employees to have that control over their total healthcare spending. So if you're an employer looking to reduce the costs of healthcare for your employees, but still maintain great quality benefits and excellent outcomes for your employees, price transparency tools are still going to be an important benefit and an important tool for addressing those costs. They just need to be paired with other effective tools such as multiple tiered networks that incentivize and steer employees towards high quality, low cost providers. So if you have any questions about that or you're interested to learn more, please contact me, John Hansbrough at the LBL Group. There's some links below in the show notes with as well to links to the research paper that I referenced. If you have any questions, we're here to help. We're helping employers reduce the cost of their benefits, but also improving quality of life for employees by working at the intersection of technology, benefits, and healthcare. Thank you. Have a great day.